Family and friends of loved ones in local nursing homes have been reaching out to the News 5 investigators asking for help.
And we hear your concerns. Our recent investigations into poor-performing facilities have shown that even a federal program called Special Focus Facility that's supposed to improve care is not doing its job for the long term.
So begs the question then, who is holding these kinds of homes accountable? News 5 investigator Jonathan Walsh has been leading our nursing home investigations.
And Jonathan, there are levels of government oversight we're talking here.
Right, and at the very top is the Centers for Medicare and Medicaid Services. CMS then asked the Ohio Department of Health to do inspections like this one right here of nursing homes, either based on complaints or on a routine basis. But when the CMS program to help nursing homes get better long-term isn't doing that, what else can the state of Ohio do for senior citizens?
We recently told you about Loeva Heights and Blossom Care Center of Cuyahoga Falls. That home was sold by Continuing Healthcare Solutions, which says it wasn't a special focus facility until after it was out of its hands back in 2022. A name change to Blossom Care Center of Cuyahoga Falls happened in May of 2024, and it's been an SFF home for 20-plus months now. The SFF program is supposed to improve poorly performing nursing homes so they give much better care.
When she does turn on her call light,
it takes a while.
Yeah, they just walk right past it. They don't pay any attention.
It just breaks my heart. I can't do anything.
CMS sent us a statement recently saying it's strengthening the program, but we also found the federal government is scaling back on staffing nursing homes 24/7 with registered nurses. Nursing homes complained about those previous regulations under the Biden administration. However, those representing families of nursing home residents like Judy Marsh and Canfield, who they claim died under poor care, tell us
the absolute last thing that the nursing home industry needs and that nursing home residents like Judy Marsh need right now are less staffing requirements for these facilities.
Meanwhile, around the state of Ohio,
our first priority is always to protect the patients.
Attorney General Dave Yost just last month talked about bringing resources together to help protect seniors. One of those partners is the Ohio Healthcare Association that represents 1,300 elderly care businesses in our state, like nursing homes.
Across Ohio, we ensure every provider understands not only federal and state requirements, but also the best practices that create a culture of safety and accountability.
As he says that, we went on to the association's website, where it provides a search tool for anyone to find elderly care. When we searched cities in Ohio, the Healthcare Association led us to its members' nursing homes that include 2 on the federal special focus facility list that CMS says are not providing the best practices or care. In fact, in recent inspections of those Ohio facilities, the state cited one in July of last year for actual harm, a fracture while trying to move a resident. And last June, the other home that's been on the SFF list for 16 months was cited for failing to ensure a resident was free from sexual abuse from another resident. The homes implemented things like re-education to all staff, complete thorough investigations, and more.
Elder abuse is not just a violation of trust. It's a betrayal of the dignity every Ohioan deserves. And our care community has zero tolerance for it.
In a separate case from the SFF homes, the Ohio Attorney General's office just this year shut down the House of Laredo nursing home in Canton after concerns about care there. So during the news conference, we asked him if there's anything more that the state can do with special focus facilities like Blossom Care Center of Cuyahoga Falls that remain on the list for months and months.
Well, I appreciate you bringing that up, and I will be candid with you that it's not something that has been on my personal radar. After this conference, I will speak with my staff and look at what this program does and doesn't do.
We asked multiple times for a follow-up interview to see what he found and ask about Loeva's nursing home in Cuyahoga Falls. His office then referred us to the Ohio Department of Health, which, by the way, has told us it submits inspection info to CMS. Do you see the circle here?
We take every single complaint with great seriousness, and we investigate those complaints.
We also heard Scott Wiley say in the news conference,
There is no state in the Eastern or Central time zone that has higher quality scores than the state of Ohio.
However, this newly released report from the Department of Aging shows Ohio's direct care staffing levels fall below the national average, and certified nurses' aide staffing was below all neighboring states except one. And the turnover rates for total nursing staffing and registered nurses were above the national average and higher than all of the neighboring states.
It's very aggravating.
sad.
It's sad, and it's
sad.
very aggravating when you go in to talk to the director of the nursing, and all of a sudden there's a new one. And then, a couple months, there's a new one.
The CEO of the Ohio Healthcare Association says the shortage of nursing staff is causing real stress on the system.
So we'll continue to work with the Department of Health, the Department of Aging, our institutions of higher education around the state, and any other workforce partner who wants to meet us at the table.
These women are counting on change, and that it happens soon for Lueva and elderly people across Ohio.
They need more
Employees.
and people that want to work, but you can't go out and grab them off the street. It's, they have to want a job and really want it.
Now, according to this profile report of nursing homes by the Ohio Department of Aging, the number of substantiated complaints in Ohio doubled from 2019 to 2022. And the state's population of people age 60 and older will continue to grow through 2030. So, Rob, fixes need to start happening now, sooner than later, and very thoroughly as well.
Speaking of thorough, your reporting has been so thorough. I'm glad it's on your radar.
Indeed, it has been, thanks to our viewers.
Thank you. Now, you can check out all of Jonathan's coverage on nursing homes on news5cleveland.com. Reach out to Jonathan directly if you have a story or a concern of your own.